My name is Darysbel Garcia. I am currently a student at Loma Linda University in California studying clinical laboratory science. I have a PhD in microbiology and molecular genetics from Loma Linda University, and I also have a bachelor's in biology from Antillean Adventist University in Puerto Rico. So as you can see, I really like science. Today I will be presenting on COVID-19. I am not an expert in this because it's brand new, but I have researched the topic and I will be presenting to you what I've learned about it. So COVID-19 is caused by a coronavirus, and coronaviruses get their name from their crown-like spikes on the surface of the virus. So corona in Latin means crown, and that's where the name comes from. These viruses cause respiratory symptoms in humans, such as the common cold. And there have been previous coronaviruses that have infected humans, such as SARS, which stands for Severe Acute Respiratory Syndrome coronavirus, that was from 2002 to 2003. And it's believed that this virus went from a bat to a civet cat and onto humans. The next one is the MERS-CoV, which is still present today, and MERS stands for Middle East Respiratory Syndrome. And this virus is kind of scary because not only is it still present, but people that get infected with it have about a 30% mortality rate. So it's much more deadlier than what we're dealing with. And so they're trying to find a vaccine for this because scientists believe that this virus might be a future pandemic. So COVID-19 stands for Coronavirus Disease 2019, and it's is caused by SARS-CoV-2. It was first detected in Wuhan, Hubei province, China, and the genome closely resembles that of a bat coronavirus. And then the spike region, the region that looks like the crown of the virus, resembles that of a pangolin. So the theory is that this coronavirus went from a bat and then it went into a pangolin and mutated, and then it was able to be transmitted into humans, causing human-human transmission. Now there are two possibilities of how this coronavirus began. The first one is the one that scientists are more inclined to. So the first one is that SARS-CoV-2 evolved in bats and pangolins and acquired mutation on its spike proteins that allow the virus to bind to a protein known as ACE2, or angiotensin converting enzyme 2, in humans. So this protein is expressed on the surface of the cells and is found throughout our bodies, including the lungs. The next possibility is that SARS-CoV-2 crossed from animal into humans before it became capable of causing human disease. The virus gradually evolved over the years to be able to spread among humans. So how does this virus infect human cells and cause disease? The SARS-CoV-2 virus binds to the ACE2 receptor that I mentioned on human cells. It then is able to enter the cell. It hijacks the replication system of the cell to make more virus products. The next thing that the viruses do is infect other cells. They infect macrophages, dendritic cells, endothelial cells, And these cells are known as antigen-presenting cells. And the reason why they're known as this is because they're able to express little pieces of the virus on their surface. So these little peptides of the virus are called antigens because they stimulate an immune response. These cells also release cytokines, and cytokines are small proteins that attract other immune cells into the infection area, and they also help cells communicate and interact with each other to help fight off this infection. These antigen-presenting cells can activate T cells, which are lymphocytes or white blood cells that are involved in our cellular immunity. And when these T cells are activated, they can transform into CD4 T cells, which are helper cells that can secrete more cytokines. And then they can also turn into CD8 positive T cells that are cytotoxic T cells. So these T cells are able to kill any infected cells that are infected with the virus. Then our humoral immunity is also activated. So we have here antigens and we have here T cells that are able to activate B cells. And B cells are another type of white blood cells that we have. And B cells can transform into plasma cells, which are the cells that secrete antibodies. In this case is IgM and IgG. And then they can also turn into memory B cells. So if you ever get reinfected with a virus, we have these memory B cells that they are specific to that virus and are able to detect it and attack the virus. Now, I want to say something about the antibodies because it's pretty important. So the antibody IgM, studies have shown that in people infected with SARS-CoV, these antibodies are able to last up to 12 weeks, but then it declines. So those patients are no longer protected by this IgM antibody. However, the IgG antibody is able to be protective for a very long time. So that's why doctors are saying that once you get if you do get reinfected with SARS-CoV-2, that you have this immunity towards it because of this IgG antibody. So this immune response causes this cytokine storm. So you have a buildup of cytokines because your immune system is trying very hard to get rid of this infection. But what this causes is tissue damage, which leads to acute respiratory distress syndrome. And what this is that basically your lungs are filling up with fluid. So that's why patients with COVID-19, they have problems breathing because of this fluid buildup in their lungs. This can lead to organ damage, and eventually it can lead to death. Now, there are different ways to diagnose COVID-19. You can be able to detect the viral nucleic acid through real-time quantitative PCR and high throughput sequencing. You also have immunoassays like ELISA, and then you have antibody testing to test for if you have the antibodies such as IgG and IgM. And then they also have CT scans that take images of the lungs. So how is COVID-19 transmitted? Well, it's transmitted human to human, and it can be transmitted through droplets. So these are the droplets that are created when you sneeze or cough. They can travel 6 to 8 feet away from you. Also by fomites. So fomites are any contaminated surface that might have the pathogen on it. So if you touch a table that has a pathogen on it, and then you didn't wash your hands and you touch your face, you are exposing yourself to the virus. There's also other theories that this virus can be transmitted through aerosol. So aerosol are these very, very tiny droplets that can be spread even by talking. And they're so tiny that they can be suspended in the air for a very long time, and they can travel farther than the regular droplets that you create by coughing and sneezing. There's another possibility that it can be transmitted fecal oral route. So this is basically you get feces on your hands, or somehow you get feces into your mouth. But these cases are unconfirmed right now. So COVID-19 symptoms can appear between 2 to 14 days after exposure, and the main symptoms are fever, cough, and shortness of breath. But there's also other symptoms such as tiredness, loss of sense of smell and taste, gastrointestinal problems. Maybe that's why I can't find any toilet paper when I go to the store. They experience chills, body ache, sore throat, malaise, headache, nausea, and vomiting. So who is at risk at contracting COVID-19? Well, here we have a graph, and it shows all the different ages from 0 to greater than 85. And then we can see that all the age groups can be infected with the virus. However, the older you get, the more likely you'll be hospitalized if you get this infection. Now, why is this? Well, when you get older, your body doesn't function as it used to. Another reason is due to underlying conditions. So people with hypertension, obesity, diabetes, cardiovascular disease, the people that are immunocompromised, like AIDS patients and people on immunosuppressant drugs because they had an organ transplant, or people with some autoimmune disease, they're at high risk of being hospitalized. People that are suffering from kidney or liver disease, and also if a person has lung disease. An example is moderate to severe asthma. Minorities are also at risk due to health disparities. Minorities like African Americans, Hispanics, Asians, Native Americans. And health disparities is a socially disadvantaged population that suffer from diseases due to poverty, environmental threats, inadequate access to health care, individual and behavioral factors, and educational inequalities. So there's not that much research right now on how COVID-19 impacts minority groups, but I'm pretty sure in the future there will be many papers addressing this. An example of how minorities are at risk due to health disparities is this graph. So here we have high blood pressure, diabetes, and stroke, and it's comparing African Americans and white. And each disease, African Americans are more likely to suffer from this disease more than white people are. So when should you seek medical attention? If you're coughing or sneezing, thank you. If you're coughing or sneezing, or you think you have some type of symptom related to COVID-19, call your primary healthcare physician. It's not a good time to be hanging out in the ER right now, because the people that are going to the ER right now probably have COVID-19, and you don't want to get it if you don't have it. So call your primary healthcare physician, and they will tell you what to do next. If you are having trouble breathing, you have chest pain, you're confused or lethargic, if you have bluish lips or face, then that's when you need to go to the emergency room or call 911 to seek medical attention right away. Currently, there's no treatment for COVID-19. The only thing you can do is that if the symptoms are mild, you do self-care, you get plenty of rest, you stay hydrated, and you manage your symptoms. If you get hospitalized, they're also doing supportive care. They do symptom management, and say like if you need oxygen, they'll give you supplemental oxygen. If you need help breathing, they'll put you on a ventilator. So things like that. There's also treatment that's currently being studied or in clinical trials. Examples of this are antivirals like remdesivir. There's also the anti-malarial and antibacterial drug combo that President Trump keeps promoting, which is the hydroxychloroquine and azithromycin. There's an antiparasitic drug also that they're investigating, which is ivermectin. Researchers are trying to make an antibody that's an anti-ACE2 antibody, which basically binds to the ACE2 receptor, and then by binding to the ACE2 receptor, the virus is not able to bind to this receptor and cause infection. They're also trying to create vaccines, and then there's also antibody and plasma therapy, in which the antibodies from a recovered COVID-19 patient is given to a patient that is currently suffering from COVID-19. Hopefully, those antibodies help that patient's immune respond to the virus and help them heal from the infection. Are there any natural remedies out there? I tried to find, but I couldn't find. So currently, there's no scientific evidence that alternate remedies help cure COVID-19. However, I did find articles related to coronaviruses and SARS-CoV-2 that they suggest that high doses of vitamin C and vitamin D may help your immune system be able to fight off the infection. There's also a paper that proposes making these masks infused with these plant compounds that are known to be antivirals. So their theory is that if the virus goes through these layers of the mask, the virus will be inactivated because these compounds are present. However, we can keep our bodies healthy and clean. So a lot of these underlying issues like diabetes and obesity can be addressed by eating healthy and resting and exercising. So if we do this, we decreases our risk of acquiring diabetes, of becoming obese. We also want to keep our home clean with good ventilation. So keep cleaning your homes, disinfecting everything. Also, open your windows so you can get fresh air in and get rid of the old air, because if this virus does suspend in the air, we want to eliminate it. So bringing fresh air into your home is really good too. So what can we do to slow the spread of COVID-19? Well, what we're doing now is social distancing or physical distancing. We're keeping 6 feet away from each other, and it seems to be working. We're staying at home. We're not going out to just go out. We're just going out to buy the essentials. We're avoiding traveling. Schools were closed, and non-essential businesses were closed as well to avoid people congregating in places. So this has affected how churches are run. The CDC offers guidance for community faith-based organization, and they offer guidance on how severe the community transmission is. So when there's no community transmission, what the churches can do is create a plan in case a pandemic occurs. This plan has to involve the local health officials also. In this phase, you also want to monitor absenteeism. So if church members aren't coming due to being sick and they're diagnosed with the same infection, you want to work with the local health officials of what to do next. You also want to make a plan on how you can continue church service if this were to occur as well. When there is minimal community transmission, you also work with the local health officials to see what to do next, see if you can still have church, but just have some ways of mitigation or social distancing so that your church members can be protected. And then when there is a substantial community transmission, which is what we have now, the CDC suggests to postpone all church activity and resort to having an alternative, like having church online where people can see it in their homes. Also, if the church can help the community, they suggest the churches to do so. An example that they put was having churches help with just be a distribution center. So if the community needs a place where they need to store medical supplies or food supplies, the churches can be that, or even the churches' camps can provide that. Also, if families cannot quarantine in their homes, they can quarantine at, say, the camps because it's safe there and there's fresh air. So these are just little things that they suggest. So if you go online on the CDC website, you can find more information on it. They also give guidance for when a person with COVID-19 has been in the facility and exposed members to this virus. So what they suggest here is to disinfect the facility, alert your local health officials to see what has to be done next. Also, you have to communicate to the church members or everyone that was in there that there was a person infected that might have spread the virus, so they need to be aware of that. But you also have to keep that person's identity confidential. So by doing social distancing, we're flattening the curve, and I believe that not only history repeats itself, but if we really study history, we can learn from it. And here I have an example of the 1918 Spanish flu. And this flu killed 50 million people worldwide. So what we have here is Philadelphia. Philadelphia did not take this pandemic seriously initially, and they waited until they saw several cases of death to implement social distancing. And the shadowed area here, the brown box, represents when they established the social distancing orders. And you can see that it was kind of too late because they had an increased rise in death and then a rapid decline in deaths. And so Philadelphia suffered a lot in this pandemic. However, if we look at St. Louis had strong social distancing measures, and so they had a very low total death rate. So we can see here that they were able to flatten the curve. However, when they lifted the restrictions up, we can see that there was a spike in cases of death. So this is what the government is trying to avoid right now. When they lift these mitigations that they have, how can we prevent these spikes from arising again? So also the church needs to be aware that when these restrictions are lifted, they have to take into consideration how to protect their church members if they start doing services in the churches, especially the vulnerable ones, such as the elderly and people with underlying health issues. So these are the questions that need to be answered right now, because this virus is going to be around for a very long time. Also, the Spanish flu came in 3 waves, and scientists are saying that the COVID-19 is also going to come in 3 or 4 waves. So we also have to look to the future. What if this happens? What if we do have waves? We're trying to prevent that, but we never know what's going to happen. But I believe we can slow the spread of COVID-19 and even prevent these type of waves from happening if we do certain things like washing our hands. So we have to be washing our hands all the time, before and after using the bathroom, before and after eating, before and after cleaning a wound, before and after touching your eyes, mouth, or nose. And also after you go, say, to the grocery store and you touch the grocery items, or you touch tables, you touch screens, you touch the gas pump, shopping carts. After you do that, you have to wash your hands. If you don't have water and soap available, you can use a hand sanitizer that's at least 60% alcohol. So here is a figure showing how to properly wash your hands. You lather up soap with water and you wash your hands for 20 seconds. One way you can measure 20 seconds is by singing happy birthday 2 times. You don't have to sing it out loud, you could just sing it in your head, but that's a good way to measure 20 seconds. You want to wash the inside of your fingernails because you can store a lot of bacteria and pathogens in your fingernails as well. Another thing that I've seen people do is wear gloves. I honestly don't know why people are wearing gloves, especially the public people. Like, you say you go to Walmart and you wear gloves. I don't see the point in it. The same pathogens that you're getting on your hands, you're also getting on your gloves. And then not only are they getting these pathogens on the gloves, but they're touching different grocery items with the same glove. They're touching their face, they're playing with their hair. They take out their cell phones and touch the cell phone with their glove. They open their car door or the trunk of the car. They touch their car keys. So all of that is already cross-contaminated. So I just don't really see the point in wearing gloves. It's kind of the same thing as just with your hands, touching everything. So if you wear gloves, wear them the right way. Don't touch your face, don't touch your car keys, don't touch your cell phone. Wash your hands before and after you wear gloves, and please don't throw them on the ground. The other day I went to Walmart and there were at least 10 pairs of gloves right in front of the entrance of Walmart. So not only are you cross-contaminating, but you're also polluting, which is another different problem that we're facing too. Wearing masks. The CDC recommends people to wear masks in places where social distancing is difficult to maintain. Wearing a mask won't protect you from getting the infection, but it prevents a person that's infected, it prevents them from spreading the droplets or the virus farther than 6 feet. So that's why they are recommending these cloth face coverings. Please leave non-surgical mask. The surgical mask, please leave them for the healthcare providers. Also the N95 respirators, please leave them for the healthcare providers, because we want them to be healthy. So if we get infected, we have healthcare providers that are healthy and are able to do their job. So wearing a mask doesn't replace washing hands or keeping social distancing. So you still have to do that even when you have a mask. And I have a video here that I got from my good friend, Dr. Osi Shioma. She posted it on her podcast, which is called Tales of an African Princess in America, and I thought it was brilliant. And I just want to show you how to properly put on a mask and how to take it off and what not to do with a mask. So here it is. Okay. So, my take home message is don't panic, don't freak out. In the movies, the people who freak out the most are the ones that die, and we don't want to be those people. So, use this information wisely to protect yourself and others. Follow the guidelines given to help fight this pandemic. When social distancing is lifted, keep practicing hand washing and stay at home if you are sick. Um, Churches need to develop a plan on how to keep their vulnerable church members safe at church after restrictions are lifted. And use this time to get closer to God. I know we have a lot of extra time now, and so it's a good time to study the Bible, pray, and meditate. And I also think that God wants us to wake up. I think we're still a little bit too comfortable in our daily lives, and I just want to share these Bible verses with you. So there will be great earthquakes in various places, famines, pestilence, and there will be terrors and great signs from heaven. Therefore, stay awake, for you not know on what day your Lord is coming. And although this sounds scary, we have to have faith in God because He promises us that He will be with us and protect us. So God is our refuge and strength and ever present help in trouble. And with that, here are my references. If you would like to read it for yourself, you can. I know there's a lot of news out there that is not correct. So I encourage people to do their research as well. Thank you for your time, and I hope you learned something, and God bless.